Aloha mai kako. On behalf of Papa Ola Lōkahi, mahalo for joining us, for taking time out of your lunch hour to join Papa Ola Lōkahi. We have a great program lined up for you, and we will be beginning in just a few minutes while we let a few more people trickle into the room. Mahalo for joining us. Aloha mai kako. It's March 2nd. Mahalo for joining us on this first episode, this launch of E Ola Mau series. We've got a great program for you. We are still waiting for one of our presenters to join us, but we know we'll have both of them in no time at all. We're also waiting for a few more people to trickle into the room. So we know you're there. Mahalo. And we'll open up the program in just a few moments. Aloha mai kako. On behalf of Papa Ola Lōkahi, we bring you episode 1 of E Ola Mau, the next generation of Native Hawaiian health. This is a follow-up to the original 1985 E Ola Mau Native Hawaiian Health Needs Assessment, which is really it provides the kahua, the groundwork. It is the catalyst for the Hawaiian health movement. It is the benchmark to which we measure all of our successes and accomplishments and slips and peaks and valleys to the original 1985 E Ola Mau. We've got a great opening presentation. Over the next 5 weeks, we will be presenting overview and recommendations from all of the reports within the 2019 update of E Ola Mau. But today we're just going to tell you a little bit about why and how, and maybe take a quick walk down memory lane. We also see that some of you joining us are part of that memory lane. So don't hesitate to put your comments or your in the chat box, or your questions in the Q&A box at the bottom of the panel on your Zoom screen, and we will make sure that we answer all of your questions. My name is Kim Ku'ule Burney. I'm with Papa Ola Lōkahi, and I will be the moderator for the rest of today for sure. And just a few housekeeping announcements. First of all, know that this webinar is being recorded and live streamed across many platforms, including those of our Native Hawaiian healthcare systems that provide services on 7 islands. Questions and answers you can put in the panel below, or if you're viewing through Facebook, you can put them in the comments section, and we will make sure that the presenters know them and can answer your question. An evaluation will be sent to each of you at the close of the webinar. And then again, tomorrow, we would be grateful for your comments, for your input, so that we know how to improve, how interested you are in Hawaiian health, how interested you are in E Ola Mau, and how we move this along to the next level. We're looking forward to your feedback. We are planning something big in 2023, a Native Hawaiian Health and Wellness Summit, and we want to make sure that you have input into that planning process. So that's what this is all about. Today's presenters will be Dr. Sherry Daniels. She's our boss lady. She's the executive director of Papa Ola Lōkahi. She has been at the helm of Papa Ola Lōkahi since 2016, and we are happy to have her join us today. Our other presenter is retired, and on Wednesdays, he spends some time at Iolani Palace. So I think that he is probably making his way to his Zoom box right now, and that is our retired executive director, Hardy Spoor. He was at the helm of Papa Ola Lōkahi for more than 20 years, and he really set the standard for navigating our state and our federal relationships, so that we can continue to do the work to raise the health status of Native Hawaiian health. But I see you there, and I see you're in your office. Aloha, Sherry.
Aloha, Velina Mai, Kim, and everybody tuning in. I'm actually really excited and waiting for Hardy to join. I think it'll be a really great conversation. I think kind of talking about the history of it, but also where we're going with E Ola Mau and the subsequent conversations around Native Hawaiian health is really important. So I think I'm really excited, and know that between Hardy and I, there's going to just be a lot of conversation that people can, chime into, ask questions. So I'm really excited. And you're right, he's probably like zooming his way home to get on the Zoom this afternoon with us. So
right, he gave us warning. I think one question that we know people are asking is this a brand new update, or did you just say 2019? And I did, and we had every intention of reporting back to our community, to the folks that we know are interested and that help to contribute to all of these reports. We plan to do that in 2020, but a lot of other things happened in 2020. And so the report back to the community is delayed, but we're doing it, and we will update as we go along, and we'll take your reflections and take your comments and build them into the next version.
Kim, you're very right. I think a lot has happened between 2019, when we first kind of did a soft launch of this in the fall, for the last 2 years, really. And so I think this has given us a chance, one, to be really thoughtful of how the last 2 years has impacted Native Hawaiian health, not just in terms of the chapters that we're going to talk about over the next 5 weeks, but really helping us guide what the next report's going to look like. And that's really important, because this document, E Ola Mau, was really meant to help us as Native Hawaiians continue to track, to continue to monitor what health means for us as individuals, as ohana, as community. And we know the landscape has really changed over the last 30 plus years. And how do we stay relevant to those changes, but also stay true to who we are as Kanaka and to the people that we serve in our communities, whether it's in Waianae or down in Ka'u or Pane'ewa or on Maui. And so I think we really want to make sure we're preparing ourselves for the next kind of update. And that hopefully will lead us into our 2023 Native Hawaiian Health Summit, which Kim, I know you mentioned. So I think those are all things. So maybe in a way, the pandemic allowed us some time to be reflective and really think through what is it that we need to do and be thoughtful as we add chapters, as we add components, even with E Ola Mau as compared to E Ola Mau, we've adjusted chapters, we've added things because we recognize that the landscape has changed, has evolved. And how do we continue to support that and uplift that in a way that's that takes the uniqueness of communities into account, but also empowers our people to choose health and what does health mean to them, not just all the junk narratives that we hear, right? That how do we embrace all the great things, all the resiliency that we have as Kanaka? So I think there is some value to the delay.
Exactly. I was thinking just the same thing. And now I think our response to the pandemic really is a big part of Papa Ola Lōkahi now. I think this is a part of our history that we need to carry with us and tell the story, because we've done, we really devoted so much of our time and so many of our resources to address the pandemic and really pull together a really strong team of folks to talk about the pandemic.
Well, and I think, Kim, I think it's great for us to recognize the pandemic and the last 2 years and the learning, the lessons learned, the things that, really uplift what we have. I think people tend to look at the pandemic in this kind of doom and gloom, but I think there are really good learning spots for us here in Native Hawaiian Health. And I think those are things that we really want to capture as well, because, yes, we might not have a pandemic in a year or in 2 years or 3 years, but those lessons help us to kind of create the pathway around Native Hawaiian health moving forward. And it allows us to expand really our thinking around what health is, right? And so it doesn't keep us stuck in silos, but also it allows us to really stand firm in our values, in our beliefs as Kanaka. I think those sometimes gets kind of at the wayside, goes to the wayside, because it's not things that are so tangible and that we know, we can see that sometimes, especially in the work we do around Native Hawaiian health and working with our communities, there's a lot of that intangible value that we have to make sure we don't forget about. And so I think that's really important as well.
Absolutely. We've got a couple of slides that we can probably look at now while we wait for our favorite Hardy to join us. Yes. All right. So Keikuni Blaisdell definitely was the mover and the shaker. And at that time, they kind of put together, they looked at what Hawaiians were in the health and public health community already. Keikuni was at the medical school. Claire Hughes was in the nutrition office at the Department of Health. Nalina Andrade was a new physician. She was in the first Imi Ho'ola class. Loretta Hussey was a nurse, public health nurse at the Department of Health. Fern Clark was part of the movement, and eventually she became the first director of the Office of Hawaiian Health at the Department of Health, which eventually morphed into the, guess what, Office of Health Equity. That's Fern Venata Clark.
Well, Kim, I think this is really important to put what the beginning is, because Kekuni was a mover and shaker in many, many circles. But what's really, really nice is someone like myself, I still can call upon Auntie Claire or talk to Nalene or Auntie Loretta to kind of understand the feeling they had, you know, back in the late 80s when they were meeting, they were coming together, they were walking the halls in DC around what were they thinking in terms of this study. What was their intention? I don't think they thought it was going to be as groundbreaking as it was, because we still have students today who use the original E Ola Mau report as a basis for some of their research projects, or they're citing E Ola Mau as a very foundational piece of research for them. And I think that's really important. But I don't think that that's why they didn't. They did what they did. They did it because it was necessary. It was important for our Lahui to have this. And I know, Kim, you've talked about what kind of not only this provided, but what led up to this. Because there was a study or a report that came out prior to E Ola Mau. And I think it's one of those it's not a really well-known study. And I think you talk about it in some of your Native Hawaiian Health timeline conversations that you do.
Right. The Congress actually commissioned a Native Hawaiian study commission. And it was made up of federal folks and some local folks, local trusted folks, and they put together a study. They put together a report that really reported on the status, not just health, but what was the educational status, the economic status, the health status, the well-being of Hawaiians across the across the gamut. And the first report that came out said that Hawaiians are good, that there's no problems in any areas. And there were three Hawaiians, including Kina'u Boyd Kamali'i, who later became an OHA trustee. And she said, wait a minute, I don't think these findings, they certainly don't support what we all know anecdotally. And I think we need to take a look at the data and really reevaluate it. So she and another couple of people did that, and they issued a secondary report, what's referred loosely to as the minority report. Officially, they're called Volume 1 and Volume 2, but it's Volume 2, which is the minority report that says, stop the press. In health, in education, in economic status, Hawaiians are actually doing more poorly than other people in Hawaii, than other ethnicities in Hawaii. And Hawaiians are the indigenous people to this place. And in some areas, particularly in health areas, Hawaiians were worse off than others across the country. So that then led to a local study, E Ola Mau, which is the Native Hawaiian Health Needs Study. So we don't talk about education and housing and economic development because there are other entities that do that, but know that that happened in other arenas too. We just have the focus on the Native Hawaiian Health Needs Study. I want to tell one story that Analika Nahulu, and she used to be called Bunny, but Analika Nahulu said that she was a public health student at the university, and she used to carpool with a bunch of other her friends and people that we all still know, like Shelley Enos and Joyce O'Brien, and they would carpool together, come in working on their masters in public health. And one day they were sitting at the picnic table and they heard "Hui!" And up on the second floor of what used to be the public health building, it was Kekuni, and he was calling down. He saw these Hawaiians sitting at the picnic table. He came down and he said, "Hui, we're working on this study and you can all be a part of it." right? He didn't ask them, would you like to? He said, you can all be a part of it. And they were, and now they're in the pictures. So that they just, Kikuni and others, they just looked to see who was where and who could do what. And there were, I think 12 or 15 Hawaiian physicians at the time. So that's why you have Emmett, and Dr. Emmett Aluli, Dr. Nathan Wong, Dr. Bill Ahuna. You have some of the earliest physicians who worked on this as well. Oh, I'm so glad we're looking at this photo now. So,
and before we keep going, I want to make sure we recognize, Hardy, aka I think on the slides it looks like he's Kiawe, but Hardy, it's always such a pleasure to share space with you, and I know Kim's going to welcome you in, but I want to make sure we know that he's arrived, and he can jump on in.
Oh, we did not. Oh, I see. He's a Keawe. We will change that. Awesome, Hardy. Aloha. I introduced you already. Is he muted?
He is. He's finding there. Hi, Hardy.
Fine. Aloha, everyone.
Awesome. Aloha, Hardy. So we were just really chit-chatting, talking story. And look where we landed on this photo from 1986. And the only reason Kikuni Blaisdell is not in the photo is because anybody who spent any time with him knows that he took the photo, which is why we have these records today. So who are these people, Hardy? I know about 3/4 of them. You're on mute.
These are the founders of the organization E Ola Mau, which Kekuni tried to put together to bring together practitioners and professional medical folks to talk about where traditional healing and allopathic medicine can join forces to address Native Hawaiian health needs. And Kekuni started it, but it was quickly taken over by the nurses. And as everyone knows, nurses indicate and run medicine, even though doctors think they do. So this is one of the founding groups, I think the founding group of the E Ola Mau organization that Kekuni put together.
Yeah, and a lot of these people are still doing the good work today. You know, Joanne is still very involved. Claire may be retired from the Department of Health, but she's still very involved in various cancer projects and serving on the board of Ke Ola Mau. Dr. Nalina Andrade, she may have retired from Department of Psychiatry, but now she's with the Queen's Health Systems. Yeah, Annalika.
Well, Kim, I think the awesome thing is later in the series, Claire is going to be one of the people sharing her mana'o. Naline was the co-chair of the E Ola Mau Revisit. So, I mean, I think this is where we're very fortunate that even though we don't have Kekuni, kind of forging ahead with us, that we have his intentions and the things he really brought to the table. And we see it in a lot of these folks, Auntie Claire, Naline, Auntie Loretta, right, that continue in the spirit of what Kekuni started. So I'm always excited and humbled that we still have these amazing, folks with Ike that can help fill in the pukas when I'm not sure, or I can't reach Hardy to kind of, hey, why this and why that? And so it really does help.
It does. Hardy, I wonder if you could share a little bit with us on the impact of the E Ola Mau Report. We all call it groundbreaking, but what has it, and in fact, students today still go to our websites and they cite it in their reports, in their studies, in their assignments. What are some of the impacts, or what is the great overall impact of the E Ola Mau study?
Well, I think if you look at the health scenarios today that are out there, the primary care centers, the Native Hawaiian healthcare systems, Ola Lōkahi, the Queen's Native Hawaiian health program. They all emanated out of that E Ola Mau health study, or have relationships of people who emanated out of that study, which actually laid the groundwork for.
Oh no. Oh no, we hope he's coming back here soon.
Oh my goodness. Well, Kim, I see that we have a question. Maybe we can answer the question while Hardy kind of
Yeah, and I know this is somebody that I've been in contact with. So it's and we're gonna answer this in the context of the E Ola Mau study. So the question on Facebook, how can Hawaiian health programs and health studies collaborate together? I work with Healthy Hearts Among Pacific Islanders, which we know is in Washington State. And that's a real good question. I think we might take for granted that we work both with the medical, public health, and Hawaiian communities. So that may not be as easy to do in other places besides, besides Oahu or besides Hawaii. So that's a really good question. We can pose it to Hardy Bombay, but maybe Sherry, you have an answer. How do you see us bringing both Hawaiian and Pacific Islanders serving communities together with the health and medical communities?
So I think the question is good, and I think it's kind of a multi-response. So first of all, you have NHPIs, and so you already have that lumping of communities, which I think one of the things we recognize is but we also saw through COVID here in Hawaii that we're able to even further aggregate that. So we're looking at Native Hawaiian numbers, just as much as we'd want to look at Pacific Islander numbers, because there are stories in those. So I think, really being thoughtful around when we need to be collaborative as aggregated data, but also when is it appropriate and when we can disaggregate even within Pacific Islanders and Native Hawaiians. So I think that's one. I think the second kind of thing to be thoughtful about is the relationship between CBOs and academia. I think oftentimes there is this need for research to be done in our communities, about our communities, which are very valid. But sometimes the connection to our community partners are often kind of not at the forefront of how we build the momentum to get these surveys or these research questions done or studies done. So I think it's really at the beginning, really having the conversations of what is the partnerships and relationships that CBOs have in these different spaces. So if you're looking at a national context, who are your partners in the different states? In Hawaii, what are you looking at getting in terms of that study? So I think that's really important. And I know Dr. Keaweai Moku Kaholokula, there's a PICO project out of the University of Hawaii Manoa, JAPSOM, where we're really looking at translational research and how to engage communities in meaningful and useful studies that engages them from the beginning, even pre kind of studies, right? To have those conversations and building trust and relationships within communities and with researchers. So that's, I think, something to just be at top of mind. And I think the third component is when we look at Native Hawaiians in Hawaii and Native Hawaiians on the continent. Not that we want to create the segregation between those two areas, but we do know that on the continent, in some states, they're not even collecting NHPI, let alone NH only data. And so we want to make sure when we're looking at studies like that, how is that information relevant to Hawaiians that still reside in Hawaii? And being really clear, because oftentimes those differences make a difference. And so I think it's a bunch of those things kind of coming together in some perfect storm. So I hope I answered that question. And I think connecting and putting it out on social media and in other opportunities, I think it's really good. But then it's also, how do we get CBOs to also be pushing that and encouraging their communities to participate? And what happens to that information when it is completed? I think that's another reality communities are asking for. Hi, Hardy.
Good answer. Hi, Hardy. Welcome back. We're gonna open up your mic again, and I think before we start talking about what the various the topics of the various reports, I want to make sure that we have a chance to hear what you hear your thoughts on the impact of the original E Ola Mau study.
Okay, well, I apologize, first of all. I'm computer challenged, so things like plugs being pulled out and things like that.
Retirement must be nice.
I don't notice. In fact, I can't even see my face. So anyway, know that I'm there. I guess I'm going to go back one more step and talk a little bit about Alulike, because it was really Alulike, which was the first Native Hawaiian corporation established in the 1970s that tried to garner and bring together a number of Hawaiian organizations. You know, one of the first studies that Alulike did was to try to identify all the Native Hawaiian organizations that existed at that time. That was in 1973. When Alulike existed really of only a board and Mrs. Rubin as executive director with research director Bella Bell. And they put together a study that just showed how important organizations were for Hawaiians. And they identified at that time close to 50 Native Hawaiian organizations, all of which had different focus, you know, whether it was paddling, whether it was translations, whether it was culturally related. At any rate, there was no real glue to bring them all together. The civic clubs were really the only entity that existed that would occasionally bring them together with their annual convention. But Alulike then, first effort was to try to do a needs assessment in the Native Hawaiian community. So from 1975 to 1976, it put together really the first assessment that was done of the issues facing all these disparate Native Hawaiian organizations and communities. And it came up with real important and concerning needs in 5 areas: health, housing, economic development. And economic development in that time was defined as jobs, employment, culture, and education. And the first thought was for Alulike that it would spearhead federal efforts because of the relationship which Myron Thompson had as chair of Alulike with Senator Inouye to start to move a federal agenda for Native Hawaiian issues. And Pinky being Pinky, he started with education and looked at how best federal efforts, particularly federal dollars, could flow here into Hawaii for education. And he started to undertake at Kamehameha schools a Native Hawaiian educational study. Learning from the pitfalls of that initial effort, though, the second effort was health. And that's when Bella Bell was asked to lead up an effort to look at the health concerns in the Hawaiian community. And that was the beginning of what became known as the E Ola Mau Health Effort or Initiative. And of course, then building upon that study, as it was being done, Kekuni and Claire and a number of others formed the E Ola Mau organization to sort of coincide with the study. And that was that study that actually, when it was finished in 1985 and reported out to the community, really started the efforts to bring in more federal dollars for Native Hawaiian programs, including Native Hawaiian education. And that was the beginning of Papa Ola Lōkahi. And I'll let Kim talk about that. But rest assured, it started with a meet. I'll just tell you where it started. I was fortunate enough to have been there. Pinky called a meeting. Myron Thompson called a meeting at his offices at Kwaihau Plaza and asked different organizations, all of which had some issues around health or some focus on Native Hawaiians, to come. He had an invitation list of really over 25 organizations. Well, about 10 or 15 came. And the word that Mr. Thompson said was, I've got word that there will be federal dollars coming down for Native Hawaiian health. We need to put an organization together, or do any of you wish to be the organization to house these dollars and to initiate efforts on Native Hawaiian health? Well, the response was very quiet. Nobody raised their hand. So Mr. Thompson in his way said, well, okay, we're going to start with a board of those organizations that have statewide programs focusing on Native Hawaiian health issues. And that was the beginning of the first board of Papa Ola Lōkahi. So I'll leave it at that point, and then Kim and Sherry can take you from there.
Well, no, it's really you and Sherry that are going to take us through. But that's important. I mean, it was the E Ola Mau study that then gave us the data. It really helped to prove anecdotally what folks in our communities, especially the nurses and the doctors and the social workers, and even Pinky as a social worker, things that we have all heard him talk about. It helped to validate, if you will, what they all knew anecdotally was going on across, as for health needs in our community. And that gave some validation to creating entities too. So yes, so here we are at Papa Ola Lōkahi, 35-ish years later. Right?
I should also mention that in the inner time between the Alulike Needs Assessment and the E Ola Mau Health Study and Papa Ola Lōkahi, there was a gentleman who was working back in Washington, D.C. for the Office of Technical Assessment in Congress. And that office has the responsibility for following up on congressional studies. At that time, Hawaii was very fortunate to have one of its keiki kaina in charge, Larry Miiki. And Dr. Miiki was given the task after the E Ola Mau health study came out to look from a federal perspective at how Native Hawaiians scored with other ethnic groups, with other ethnic problems in the United States, to really try to put a picture on what the issues were and where they actually ranked in the nation. And Dr. Miiki undertook that assessment and reported back to Congress that indeed Native Hawaiian health issues were at the top, if not the top priority. But there's an interesting story that goes along with that Mr. Thompson would often tell. He indicated that the Senator Inouye had called a meeting back in Washington, D.C. to talk about Native Hawaiian health and the results of that assessment. And Mr. Thompson pulled up in his car, and there was a gentleman there with blue jeans and a t-shirt on who walked up to him and said, "I'll take your car, sir." And off he drove with Mr. Thompson's car. Well, that person in blue jeans and a t-shirt was Dr. Miiki, who eventually comes back to Hawaii and is the first executive director at Papa Ola Lōkahi.
Great, Hardy. Thank you so much. I wonder if we can return to the update that we're talking about now. There we go. So E Ola Mau Well, these are, these are the various areas that the E Ola Mau recommendations have impacted in the way that care is delivered, in the way we preserve, protect, and perpetuate Hawaiian healing traditions, in building a cadre, a workforce of Native Hawaiian health providers, and in our public health policy. So I wonder if you could talk, both of you can talk a little bit about the impact of, and maybe even some specific examples, the impact of E Ola Mau in some of these different areas.
Sure, do you want
Yeah.
Well, I think, again, Hardy, you were there really helping to kind of shape us for 24 years. But I think from when, Hardy was at the helm here at Papa Ola Lōkahi to where we are right now, I think there are some differences in where the landscape has shifted. Not that, public policy and health workforce isn't a need and a priority, it continues to be. But then I think when we are looking at bringing in Native Hawaiian physicians or health professionals, what does that mean? Where today we're talking not about just health professionals, but allied health professionals. How do they fit into the cadre of workforce? But also having the real serious and I think legitimate discussions around, we would love to have more Native Hawaiians in health professions. Oh, absolutely. But we actually have to figure out, how do we help uplift those non-Hawaiians who are serving in our communities with our families, with our individuals, with our kanaka, and help them be pa'a in the role that they provide with our lahui. I think that's also really important. One, in terms of us being clear of our narrative and our story, but also recognizing that we're already at a shortage of physicians, for example, and couple that even more so with Native Hawaiian physicians. So how do we make sure care is provided, that we are looking at moving the dial of health for our communities, recognizing that we may not always have a Native Hawaiian health professional at our door, but how do we help that cadre of providers be relevant, be useful, have meaning in providing healthcare and having our communities understand what health means to them. So I think for both Hardy and I, we can see the growth of what that means, but maybe the adjustments to what's happening in society and in our communities. That's really important. In terms of public policy, I think it's really hard to recognize that policy doesn't equate politics. And I think it's so easy because, E Ola Mau really helped shape the Native Hawaiian Healthcare Improvement Act that it is now. But we also recognize, and I'm sure Hardy can give examples, that we still struggle with finding space where we're a standalone, right? Recognized as a standalone, that Native Hawaiian health is that important, that we don't have to be embedded under other vehicles to be recognized and authorized to oversee this act for health for Hawaiians. So I think there's a long way to go. I think we've come a very long way, but I think it's also because we see health not so much in a siloed approach, but we're seeing health, which our ancestors and our kupuna all recognize, that it's all, right? It's all of that makes up a kanaka or a person. But now we're actually trying to model that in the work we do, and we don't, right, go, oh, it's health, not education, or it's health, not housing, where we know health and housing and education and economics and traditional practices all are important in the health of people. So, I think it's those kinds of things that we have to recognize and acknowledge the hard work that, folks like Kekuni, that Pinky, all of them that created the pathway. And now we got to kind of go back and get out the machetes and, clean the pathway a little bit more so it's clearer, but recognize that as Kanaka, we know how to do this, and understanding, I don't want to say the game of policy and all of that, but understanding how we can still have our voice. I think that's the biggest difference from, you know, Hardy's years at the helm and mine, is that we really need to stand firm and recognize the value we bring innately, right? We don't have to try to fit ourselves as hard as we've had in the past. I think we know what we need to do. So Hardy, what about you? I mean, I know you also see things from a different perspective and similar to me.
Well, I would just say that what's become increasingly clear is that the social determinants of healthcare are so much more broad than we initially had conceived. But as time has passed, health is so broad and has so many aspects. But I would view these different categories as tools to start to try to, or to continue to look at how social determinants of health enter into all of this to create a healthy individual, a healthy family, a healthy community. And that these are some of the tools that that the Native Hawaiian Healthcare Act coming out of E Ola Mau can be helpful to provide. Healthcare delivery, well, the delivery system as conceived in the Act is through a Native Hawaiian healthcare system or systems. The initial thought was to have primary Native Hawaiian healthcare centers. But I think as everyone remembers from those early days, there wasn't enough money to actually have primary care centers on each island. So a delivery system that linked the Native Hawaiian community with health provisions from existing healthcare providers was what was originally conceived. And these have all changed over time. Healing traditions, the Native Hawaiian Healthcare Improvement Act, or I should say the Native Hawaiian Healthcare Act, was the first federal legislation of any legislation that recognized the role of traditional practitioners, whether we're talking about American Indian, Alaska Native, or Native Hawaiian. The Native Hawaiian Act was the first one that did that. And I think everyone realizes that there is a role, a very important role for the traditional practitioners in the community. Workforce development was the Native Hawaiian Healthcare Scholarship Program, which Sherry has already discussed, which I think in the long run will be a lasting legacy of and for Native Hawaiian health, because of the fact that early on there just were not enough Native Hawaiians in the health professions, and I think the scholarship program has begun to focus on that effort. And now that my screen has disappeared, I can tell you what the other entities are. But policy.
Hardy, can you correct me if I'm wrong, but I believe that for traditional healing traditions, that's kind of a unique piece in our legislation, in our Native Hawaiian Health Act, that we are very clear about Native Hawaiian traditional healing practices, as well as Native Hawaiian traditional healer. That opportunity is not seen in other spaces, including the Indian Health Act.
That's right.
That is very unique to us, and I think that's something that the listeners should be very keen on, is that status is very specific and unique to Native Hawaiian health.
Yes, exactly right. And the other health policy, the Native Hawaiian Healthcare Improvement Act, or the Native Hawaiian Health Act, was the first legislation to actually indicate that it was federal policy to improve the health status of Native Hawaiians to the highest possible level, not just par with other groups, to the highest possible level. And then the second part of that is where the hard work begins. where it says also, and to provide all the necessary resources to effectuate that policy. Well, that means we're talking about millions and millions and millions of dollars. And that's where the work that Sherry and Kim and the others at PAPA is so important, because that's your voice back at the federal level in terms of effectuating the purposes of the Native Hawaiian Act and Native Hawaiian Healthcare Improvement Act. Yeah. So those are just some of the efforts that relate back to that initial chart.
That's it's such important to have those pieces in the legislation, in the law. I want to go back to, I worked several years with you, Hardy. And one thing that we always did when we were at conferences was we always ended up with the recommendations. And I think that, I was mentored by Joanne Sark. And I think this comes out of E Ola Mau, not just how do we articulate the problems. It's really easy to identify what the problems and the issues are, but how do we always flip those into recommendations and then advance those recommendations into systems change? And so that's the key part. We have the recommendations for the 2019 E Ola Mau on our Papa Ola Lōkahi website, but you also, throughout your work, Hardy, you refer to those recommendations to see if there are any changes. Things like, a hui of Hawaiian psychologists was formed in E Ola Lāhui. Aha Hui o Nakoka, Hawaiian physicians, was formed in 1998. I mean, there were things that resulted as that occurred or developed or were established as a result of that early work. And I wonder if you could just talk about the process of following up on those recommendations and sometimes just reevaluating them, and making adjustments, but because that's the work that we continue to do is based on those recommendations, right?
Exactly. Well, a lot depends on people. You have to have champions, and we're very fortunate that in those disciplines that you noted, there were champions that emerged, and some of them from the scholarship program to take the lead, and some of the folks who actually pioneered the effort, like Emmett and Kekuni. They were all champions to make things happen, to make things move. And it's hard to do those types of recommendations without champions to help in that process. The other thing to think about is how to build coalitions with other groups. And we were fortunate that we were able to build coalitions both with our Pacific Island peoples, our Maori friends, and also with our American Indian friends. So I think coalitions with other groups is critically important. And Kim will remember the trip we took to Alaska, where we all froze our akolis, but it was a wonderful time to build some of those coalitions. And I think Papa's strength is that it continues to do that. I know Sherry and you and others all participate in the broader indigenous peoples community. And that's critically important, I think, in this day and age.
Kim, I agree with Hardy. And I think one of the realities of life is when we create documents that have recommendations, right? A lot of times individuals, organizations are coming to the table because they see value in that document, in the work, or they were strong-armed by folks, i.e. maybe Kekuni, and right? But what happens is those recommendations, when attached to an organization or, right, there has to be some kind of a check-in, a reconvening, a follow-up, and people move, people change, right? And so priorities of organizations, level of commitment, no right or wrong, shifts. And so when we look at, because I think we often get asked like, well, 1985, 88, 2019, that's a long time. Where were you? Well, we were doing the good work, but also too, we were like many Native Hawaiian organizations where we didn't need the accolades and the pats on the back to say, good job. we knew that our communities were still struggling in different ways. And so we kept doing the work. I don't think we stopped to say, look at this, here's what it is. And right or wrong, but also I think we never saw ourselves, Hardy, correct me if I'm wrong, as the accountability police. That we're going to look at, okay, Alulike, you said you're going to do recommendations 1 through 5. Where are you? I don't think we saw ourselves in that role, because as collaborators, conveners, bridgers, it was about where is the investment that other people have to Hawaiian health, and how do we collectively have that voice? So I think that's just part of figuring it out, and we have done things along the way. So I think with this E Ola Mau, step 1 is this: let's have a conversation back to community. This is what we see. These are the differences. Here's the recommendations. And really our thought and our plan and our want is that we would reconvene these chapters. We would reconvene those folks that had conversations back in 2017 to 2019 to say like, what's been happening? What hasn't been happening? How come? So that we have a better understanding of where we need to push, where we need to adjust, where we need to pull back. But also it helps us adjust the chapters. For those of you listening, the chapters in E Ola Mau look very different, similar yet different from E Ola Mau, because we included things around data sovereignty. We included things, we separated out dental and nutrition. So they're standalone chapters, and they were done very intentionally. And that's the reconvening we're hoping will happen after we share back, so that we can see where we got to adjust for the next review of report. And we want to then coincide it with the conversations with our summit next year in 2023, so that we can bring more people's mana'o to the table, because we know there's an up and coming generation of Native Hawaiian leaders, workers, community, movers and shakers that want to have the ability to share mana'o around health for our people, because we know it's going to expand and be broader. And so I think that's our commitment moving forward. But I think it's also recognizing, from the original E Ola Mau, that it's okay for us to not feel hila in having conversations and asking our peers and our colleagues and our other NH organizations, like, hey, are we in this to win it, or to be a stronger coalition of voices moving forward? So I just wanted to kind of throw that out.
And I think, Sherry, you folks need to be commended because of the whole situation around COVID and the virus. You have held the health department accountable, forming your Native Hawaiian Pacific Island group for reporting, which is drastically important, I think. I mean, when the health department isn't even indicating that it has separated out Native Hawaiians as a reporting function as it related to the virus, you folks called them on that, and they are required by federal legislation to do that. So having your group and Keawe's and the whole structure that you created, I think could not have been anticipated prior to the virus. And the fact that you folks were able to mobilize and come together, I think is just a great example of how important it is that you have partners to focus on these things. And you need to be recognized and congratulated for undertaking that.
That's great, Hardy and Sherry. Good closing remarks. I am so sorry that the hour has come to a close, because I know that there are many things we can talk about and learn from our past and, take those lessons into the future. And I always hope that I am, here, I am talking with both of you, that, we can bridge the past and the present into the future and move us all into the future. And we're hoping that a discussion and, more importantly, community input into the different reports, the latest E Ola Mau reports, is what we really seek from the audience, from you listeners, and from those your constituents. We really want your input so that we can have a better understanding over the next year, and we can create even better recommendations to follow up on, to promulgate to policymakers and decision makers and so forth. So Tertia's pulling up this slide. These are the presentations that we have coming up over the next 5 weeks. Next week, we'll be looking through the historical and cultural lens. Hardy has already talked about how very important this was back in the 70s with Alulike. Then we'll be looking at behavioral and mental health and well-being on the 16th. We'll have the medical report on the 23rd. We'll be looking at 2 reports, nutrition and oral health, on the 30th. And our final one will be the Hawaiian health workforce and data governance. Again, 2 separate reports will be reported on April 6th. And then throughout the year, we're going to have some sort of platform that we'll announce in the future where we can actually do some community scoping, take your comments, whatever you have that you want to build into the next version of E Ola Mau, and we want to stay connected to all of you who are listening and to those you represent. So is there another slide here? Mahalo nui to our panelists, to Hardy Spoor, our Executive Director Emeritus, or we'll just call him Kupuna.
No,
And to Dr. Sherry Daniels, our Executive Director. My name is Kim Ku'ule Burney. This has been a pleasure and a privilege for Papa Ola Lōkahi to launch E Ola Mau. Mahalo to all the back of the house people. We've got a lot of people pushing buttons in the background. Tertia Ku is the research and data coordinator, and she put together the slides. In the background, we also have Momi, Keawe, and Kamuela, who are assisting, part of our techie crew that are assisting right now. Hina and another Momi who did our graphics and put things together. So we've got a really strong team here. E Ola Mau is here for good, and it's here for the Lahui. And mahalo for tuning into this first episode. This is a launch, and we're going to be moving in. Stay tuned, come back to us over the next 5 Wednesdays, and we'll be presenting the findings from all of these reports. Sherry, Hardy, mahalo nui, aloha nui.
Aloha, mahalo.
Aloha nui kako. E Ola Mau.
E Ola.
Eo.